Hello, I'm Cindy Girton Anderson, Director of the Washington State Employee Assistance Program, and I will be providing you with an orientation to your EAP benefit. The EAP first began in 1972 as the Employee Advisory Service, a workplace alcohol intervention program. Over the decades, our mission expanded and our name changed. Our purpose now is to support the well-being of public employees and to promote a resilient and productive workforce. We help employees address both personal and work-related concerns by offering free and confidential services. RCW 4104-700 established the EAP into law, and it describes why the state offers an EAP, ultimately to foster a work environment that promotes safety and productivity as well as the health and well-being of employees. Your employer provides this benefit free of charge to you for two main reasons. One, because they want to encourage employee well-being, and two, because there's a good business case for offering EAP. Research shows that when employees use their EAP, it reduces absences from work, increases focus and engagement at work, and improves overall satisfaction with life and with work. These outcomes are positive for everyone, both the employee and the organization. I also want to make the connection between EAP and the Governor's Results Washington initiative. One of the goals of this initiative is to create efficient, effective, and accountable government. Success measures for this include being an employer of choice, to have public employees experience high job satisfaction and be engaged at work, and working to create a positive workplace culture, one in which leaders create cultures of respect, build strong teams, and give feedback that improves performance. EAP services help organizations meet these goals. Our work is ultimately about helping Washington state government function at its best. We serve all of Washington state government agencies, but we also contract to serve other public entities, including much of higher education, fire districts, public utilities, and so forth. Our specialization for over 45 years has been working with public employees in Washington state. If you aren't sure if we're your EAP, your HR department can let you know. When I tell people I work for the EAP, most people say, "Oh yeah, that's where you go when you're in trouble at work, right?" But employee assistance programs are so much more than that. We can help you in a number of areas, including change, stress, financial concerns, relationships, family issues, grief, and mental health. I encourage you to think about using EAP for maintaining wellness. Don't wait until you're in a crisis. We have a broad array of services to meet various needs, and no concern is too big or too small to seek help from EAP. Now I'm going to review our core EAP services, which are counseling and consultation, crisis response, and capacity building, and talk about reasons why people might contact EAP for each service. Our counseling services are sometimes referred to as an EAP assessment. I don't prefer that term because it might make it sound like we're going to give you a test. Rather, an EAP assessment is an opportunity for you to meet with a professional counselor to identify your concerns, get support, develop an action plan, and get connected to resources in your community to address those concerns. This happens over the course of 1 to 3 sessions. You can use the EAP multiple times a year if you have new problems that arise. We offer appointments by phone and also have counselors all across the state that you can meet with in person, so it's local and convenient. We recognize that if you have a partner or adult child living at home who is struggling with concerns like addiction or mental illness, it may also impact you and your ability to be present at work. So, other adults in your household can use EAP counseling services as well. If you need support for a child under 18, we ask that you as the caregiver come without the child so that we can discuss the situation and the impact it's having on the family and get you connected to the right child specialists and give you some parenting support as well. EAP assessments are distinct from outpatient therapy in a number of ways. First, we're free for you to use. There's no copay, deductible, or bill that you have to worry about. Our goal is to provide easy and quick access. Unlike therapy that goes through your health insurance, you don't have to have an approved diagnosis or medical necessity to use EAP. Remember, it can be used for a variety of issues that wouldn't necessarily fit into your mental health benefit. It's short-term and solution-focused, so it's really a practical way of dealing with work or life issues. The counselor is there to help you figure out the best resources and path to take to get you the help you need. Providers will assess your needs and give you referrals and link you to ongoing support in your community. And as a workplace service, we will help assess any impact that your concern is having on your job and help you figure out how to manage that. Here are some reasons why people might use our counseling services. I show these examples to give you a sense of the broad reasons that someone might look to EAP for support. They include concerns about your child, parenting advice, resources and support for caregivers to an aging parent, help with addiction, domestic violence, or sexual assault, support during a time of grief and loss, help managing stress, anxiety, or depression, or support during a relationship conflict. You can call and ask for help with any problem that's getting in the way of your life. You can also use EAP for issues happening at work, such as stress on the job, mistreatment or conflict at work, or issues with work performance. We provide a neutral and confidential place to talk about those issues and provide coaching, problem solving, and resources to help you come up with solutions to whatever workplace issue is going on. If you call with a concern specific to the workplace, we'll set you up to talk with one of our in-house EAP staff counselors who are state employees themselves and understand public sector work culture and the rules and policies that govern workplaces. Another core service that EAP provides is crisis response after a traumatic event. When a significant loss or traumatic event occurs, we help managers on what to do in the aftermath and walk them through the best practices for supporting their work group. When appropriate, we can come in and facilitate a debriefing or an educational group about grief or trauma. This isn't needed most of the time because people are quite resilient, but in certain situations, it's helpful for us to come in a few days or weeks after a traumatic event and work with the group. Examples of times when a debriefing might be arranged are when a coworker dies from suicide or if there's an active shooter incident. Any of those kind of traumatic events where you in your everyday work and life aren't prepared to cope with the experience. And when we come on site, these sessions are always voluntary and focus on education about how grief or loss are impacting the work group and ways to promote self-care. EAP offers a wide variety of other resources to support you and build employee capacity. Some agencies and organizations provide an added legal and financial consultation benefit and work-life website that you can find in the work-life section of our website. You should receive information from your HR department if you have this added benefit, but you can call us to ask or check with your HR department. And even if you don't have this particular benefit, still call us for legal and financial concerns, and we'll help you find other resources to support you. We have many publications on our website. There are resources by topic, great newsletters, which you can subscribe to on our homepage. And we host monthly live and also recorded on-demand webinars on our website on topics including suicide prevention, emotional intelligence, stress and anger management, and more being added regularly. EAP also provides assistance for HR managers and supervisors. They might need help coaching on how to have a conversation with an employee who's struggling with performance, or resources for an employee who is suicidal or experiencing mental health issues or substance abuse, or they might need help managing conflict on their team. These organizational services are offered by our skilled EAP staff counselors with experience and knowledge working in the public service sector and higher education, and can be done via phone or at our office. We can provide same-day consultation for urgent matters. You access all of these services by calling us toll-free at 877-313-4455 or visit our website, eap.wa.gov. When you call, you will talk with one of our wonderful intake professionals who will ask for a brief description of why you're calling so they can get you connected to the appropriate support. If you are seeking counseling or consultation, they will either schedule you with a counselor on our staff, or they will give you a referral to a local provider in your area who should be able to offer you an appointment within a week. If you are calling for help but don't necessarily want to talk or go see a counselor, our intake professionals can point you in the direction of the right resources. Our intake and scheduling hours are Monday through Friday, 8 a.m. to 4:30 p.m., but we do have on-call clinicians available 24/7. So if there's an emergency and you call after hours, there's always an option to talk to a counselor. And if you call to schedule an appointment after business hours or while we're on the other line, please leave a message and we'll get back to you quickly. One myth about EAP is that it's just for employees who are under corrective action or are told by HR to attend. But 98% of employees come totally on their own or because a supervisor may have suggested it simply as a means of support. It's in less than 2% of cases that an employee is formally referred. A formal referral means that the employee is having performance issues and HR or management has reached out to EAP and referred the employee to us. And in only these cases does the employer have a right to know if the employee followed through with services. In those cases, it's still always voluntary, and choosing whether or not to participate in EAP by law cannot factor in decisions affecting job security, promotional opportunities, or corrective or disciplinary action. And most importantly, even if you're referred formally by work, the content of your counseling remains confidential. We don't report back to your employer the things that you talked about in your counseling session. Here's RCW 4104-730 that describes in detail the law around EAP confidentiality. It says your participation in EAP is held in strict confidence. And it describes the exception to this, which is the limited information we report back in the case of a formal referral. I want to address a few other common barriers to employees not using their EAP benefit. The one we hear the most is concern about confidentiality. Because the law says attending EAP and the content you share with us is held in strict confidence, EAP records are different than those open to public disclosure. Also, we are all licensed counselors and just like any therapist or doctor, are mandated to maintain confidentiality unless someone's life is at risk or by court order. The only information agencies or organizations will receive is de-identified aggregate data that does not relate back to any individual. Often there's a stigma associated with reaching out to EAP, but you deserve a safe place for support, and there's a benefit to not waiting for a crisis before you seek help. Sometimes employees think they need permission from a supervisor to access EAP, but you don't. You and your family have free and confidential access. We will ask you what agency you work for, but we don't need verification of eligibility. People might think that they don't have time to use the EAP. There's a WAC that says leave with pay must be granted to state employees to receive help from EAP, and a WAC that says getting help from EAP is an acceptable use of state time and resources. Most union agreements also include access to EAP. Check with your human resources consultant for your organization's policies. However, you may prefer to keep your use of EAP private, in which case you're also welcome to use sick or vacation time for appointments or come during non-work hours. The best advocates for EAP are employees who have used the program. So here are just a few quotes of what your colleagues have said. EAP was instrumental, a wonderful resource, extremely helpful, improved performance at work, helped at a critical time at work, gave effective strategies, and I highly recommend it to others. In summary, Washington State EAP is free, confidential, and accessible. We are expert professionals here to offer practical help in a caring, respectful, and culturally relevant way. We are here to support the whole person, not just you at work, not just when you are in a crisis. We look at the holistic needs of the person and provide resources to empower you to be your best self. With that, I've reached the end of my presentation. Thanks for spending time with me today. I hope that you have a great rest of your day, and please never hesitate to reach out. We are here when you need us. Thanks.